The sport injury I decided to focus on for my sport injury webinar is fractured ribs. I will go through the bones affected, muscles affected, the cause of injury, some possible complications, recovery time, and recommended physiotherapy exercises. The bones affected by this injury could include any rib, including true, false, or floating ribs, and this injury can affect only one rib or multiple ribs. The main muscles involved in rib fractures are the intercostal muscles that allow the rib cage to move up and down. These muscles can be strained by any type of activity that involves forceful twisting or swinging of the arms, so an acute injury such as fractured ribs would put a strain on these muscles. There are two main categories related to the cause of this injury: traumatic or atraumatic. Car accidents are a major contributor, especially when the chest is slammed against the steering wheel. Falls off ladders or roofs, and sport injuries such as heavy tackles are also causes. Crush injuries when something heavy lands on your chest, as well as assaults such as getting hit with a baseball bat, and even repetitive movements in sport such as golf, football, or rowing can cause fractured ribs. In terms of atraumatic, a common condition that causes fractured ribs is osteoporosis or bone cancer, both causing weak bones that are more susceptible to rib injuries. Severe coughs, usually combined with osteoporosis or bone cancer, in severe cases can cause fractured ribs. Many of the complications of fractured ribs have to do with the organs it protects. A pneumothorax is one of the most common, a collapsed lung due to either the air pressure changes within the lungs that creates a tear or a punctured lung caused by a middle rib. The top three ribs can cause cardiac or blood vessel injury if they puncture the heart. The broken end could hit the coronary artery or the aorta, causing traumatic bleeding. The lower ribs can cause splenic ruptures, creating massive bleeds in the abdominal cavity. Overall, the ribs protect the heart, lungs, spleen, liver, and kidneys, among others. A rib injury leaves them vulnerable to injury, as well as increasing the possibility of a piece of bone lacerating any one of the organs. The estimated healing time is about 6 weeks of at-home pain management and self-care. There are a few recommended physiotherapy exercises such as gentle range of movement exercises, breathing techniques, and thoracic mobilization. For fractured ribs, it is recommended to start gently moving as soon as comfort allows. Fear of movement and protective postures causes muscle imbalance in the thoracic spine and chest. This creates persistent pain that lasts longer than the injury takes to heal. Early mobilization promotes spinal mobility and prevents persistent pain. The active cycle of breathing technique is recommended to clear secretions from the lungs and prevent further injury from cough. The ACBT cycle is made up of 4 sections, including relaxed breathing, deep breathing, puffs, and coughing. Finally, thoracic mobilization is recommended to prevent the mid-spine region from becoming stiff with pain and tightness. The main exercise is lateral twists. These begin with sitting in a chair with one's arms crossed and gently rotating each way, feeling the stretch in the upper back. This is recommended to be repeated 10 times, 3 times a day. And here are my sources for my presentation.